Hello everybody, it is Cookie Lou in Arizona, and today is the 11th of May. And I'm here today because I'm going to give you an update on my plastic surgery. It's been, excuse me, you know me, my drippy nose. June 5th, which was a year ago, a little over a year ago, I had my arms done. I had a brachioplasty, and this is pretty much what my arms look like as far as the scars go. As you can see, they're pretty nicely healed. You can barely see them. Here's the other one. Is this the right one? You see the incision goes all the way down. Goes down to here. That's it. You see? Healed very nicely. Very white. They feel a little tender if I, touch them. Sometimes they get a little itchy for some reason. Itchy. Oh, I put some cream on them. They're fine. Goes down to here. Whoops, not down to here. That's the arms. Now keep in mind, I still have, of course, flappy skin, but I'm an old lady. The doctor that did my plastic surgery was Dr. Francisco Sauceda out of Monterrey, Mexico. And he did my arms in June a year ago. And I had old implants in my breast from a surgery that was done about 35 years ago. And my history with my breast issues was I had underdeveloped breasts. My breast on my left side was larger, a little bit larger, like maybe a B, small B cup. So it's kind of what they call POTUS breast, which was just a floppy breast. And the breast on my right side was a very, very small breast with just a nipple and a little bit of breast tissue behind it. Kind of looked like top of a baby bottle, I would say. They call it a tuberous breast. So I didn't really have, it was undeveloped and it was very lopsided. And it was for a young woman. I was fortunate enough to have a wonderful husband who didn't care. I didn't care, and as the years progressed on and I got bigger and bigger and bigger and bigger, my breasts looked even more camouflaged, I guess, in all that fat. But still pretty ugly, in my opinion. Any woman's opinion when it comes to the look of a breast, nobody would have been happy with that. So in 1989, I had my first plastic surgery ever. I was about 39 years old. And I had 2 surgeries on my breasts to make them balanced and symmetrical and normal looking. I had a wonderful doctor here in Arizona at the time, Dr. Jerry Baines, who's long since retired. And he did a lovely job. He reduced one and did a lot of his plastic surgery magic. And after about 8 months, he was looking at them. He says, I'm not satisfied. He says they could be better. He thought they were a little too pointy, more like torpedo shaped, and he wanted them to be fuller and more set back. So he had to do a little bit of extra magic. I had a second surgery about 8 or 10 months after the first. Ended up with a nice full-size, symmetrically balanced C cup breasts. So very, very happy. And that was fine, for many, many, many years. And at the time, they used the soft, jelly, honey-type textured silicone breast implants at the time. That's what they were using back in the late 80s. So as the years progressed, my breasts kind of flopped down. I had the breast implants up here and the breast tissue hanging down here. Still looked okay in a bra, you know. So, everything kind of got pushed back up into place. But when I started having my plastic surgery revisions, skin removal from the major weight loss that I had, I figured it was time to take these out, because since I did them, which was 30 some years ago, it's been advised by plastic surgeons that anyone who has implants, even the state-of-the-art ones now that are not that jelly type that I had, that every, like 15 years or so, you should take them out and exchange them for new ones, because they can go bad. They break down, whatever, especially the ones I had. So I decided that when I was having my skin surgery, I had Dr. Sosada remove the old implants and put in newer ones, more cohesive, state-of-the-art implants, which he did. And when he opened me up and he took out the implants, I had my friend Kristen Bonilla with me. We were both doing surgery at the time with Dr. Sosada in Monterrey, Mexico. And when she was there waiting for me to get the surgery, he came to her before I woke up. And she says, "Lucille, he looked like a ghost." He looked like a ghost. He says, "Oh, there was a problem, And he said that one of the implants had ruptured. And there was a lot of bacteria-riddled overspill in my chest cavity that he had to clean out. When he opened it up, the whole thing just kind of fell apart. It didn't fall, but I've seen surgeons who were doing surgery on TV, and when they have a busted implant, a ruptured implant, and they take it out, it's just really a mess. It's completely shredded and torn, and the jelly is just oozing out of it. When he showed me what he took out of me, it looked like there was a slice in it or a crease in it, and it had been deflated somewhat. It wasn't, he didn't hold it up to show me, maybe it would have been a little bit more gooey if he had done that. They were laying in a linen napkin when he showed them to me. And one of them, the one on the right side, which was the bigger of the two because of age, had ruptured and turned all brown and ugly, and I have some pictures of that online if you want to see it. But anyway, so that's what they tell you, every couple of 10, 20, 15 years, take them out and redo them. So anyway, he took them out. He did not want to put any new ones in at that time because of the overspill and the extensive cleaning of getting that bacteria gel out of my breast cavity. He wanted to make sure that I was healed well before he started putting any new implants in. So when I woke up from that surgery, my arms, of course, were done, and my breasts were flat as a board. This is what happened. So, and then I realized that he says, "No, Lucille," he says, "it's best that we wait 6 months, have everything heal, make sure everything is good," because it was quite a mess in there. And he says, and then, if you still want to do it, we'll put in some new implants at that time. Because I knew I would have to have a tummy tuck done, and he would not do his famous one-and-done surgery for me. One and done is women or people, mostly women, who are younger and healthier and not on blood thinners and don't have afibrillation, a regular heartbeat. He'll do one and done, a good 13-hour operation where he does the knees, the legs, he does the full 360 circumferential tummy tuck. He'll do the breast lift and augmentation. He'll do the arm lift, brachioplasty, the whole thing, all one and done. With me, he wouldn't do it. And truthfully, at my age, and being that I was going to come home to a house without anyone to help me, recuperate, I'd be on my own, I didn't want to have a one and done. I said, let's just do it in segments. I'll take multiple trips to Monterey if I have to. Let's do it in the safest way possible. And that's what he told me, safety first, Lucille. With me, It's all about the safety of my patients. He says, I will not do everything at one time with you. Just won't do it. He says, I'll do 2 operations. He says, I can do, your tummy tuck and your breasts, or I can do your arms and your breasts. The legs, we're going to wait until the end. That's what he did. Did my arms. He took out the implants, the old implants, did not put new ones in because of the mess. Wanted me to rest and recoup. So he kept me in my regular little tiny deflated breasts for 6 months. When I went back for the tummy tuck in November, December, January, February, March, April, May, June, 7 months ago, he put in the new implants and he did the tummy tuck. So that's what I'm here to show you now is what I look like. Of course, the arms are a year out, and you can see that they are very well healed. The scar is well placed in, where it should be, under my arms, so that, when you put them down, the arms are fine. They were down to here before. You can see that they're pretty okay. And they heal very well. Hurt like a bitch when he did them. Just how there's a lot of nerves involved and tendons involved, so there was a lot of burning and pain from the forearm all the way up. And it took probably about 6 months for me to kind of feel normal, 100% normal. Wouldn't say 100%, I'd say 90%, because there's always that little itchy, nummy, tender, funny kind of feeling on the and I can still feel it, it's still a little tender. But anyway, that's what it looks like after a year. Now, the recent surgery that he did in November, 7 months ago, he put in the breast implants and he did the tummy tuck. So I'm going to kind of show you that. Okay. All right, this is the breast implants, which I cannot show you everything, but the incisions are a little bit pink. That's about it. Just a little bit pink. I hope I'm not showing you anything. I think I did show you a little nip. Sorry. But this is what they kind of look like. They are, sorry about that. These are size Ds, which is, for my build, a good size. I have gained 10 pounds. I weighed in at 183 this morning, and it's all up here pretty much. Since since my lowest weight I think was 173, and I'm 183 to this morning. And it's kind of all up here. But this here is the tummy tuck incision. As you can see, it's extended tummy tuck. It came right out to here. He took all the fat off my hips. And that's the extended tummy tuck. I should have probably gotten a 360 so he could have lifted my butt up, but I didn't. I said, oh, just get rid of the hips and the tummy. He took 7 pounds off of that. I don't know if you can see it clearly, but he took 7 pounds off of that. My stomach is flat. What does it feel like? It feels tight. It feels hard. It feels nummy. It is getting a little bit better. It's not as numb as it was when we first did it. But it's only been 7 months, so this really is not bad for 7 months. It probably was more like this when he first did it. All this loosey-goosey stuff down here was more tighter. As time proceeds, swelling goes down, healing takes place, it kind of just gets normal. This is what normal people look like. And I did gain 10 pounds since he did it. You're not supposed to gain any weight when you have any kind of plastic surgery done. So anyway, people, that's my update. It's a year on the arms and 7 months on the tummy tuck and the breasts and the story of my surgeries. And I'm happy with what I had done. And that's about it. So if anybody is looking for a good plastic surgery that is affordable, um, go to Mexico. There's lots of wonderful doctors there that are very competent. They do very good work. The care that you get supersedes any care that you would get here in America. And sad to say, but it's true. Dr. Francisco Soseda, and you can find him on obesityhelp.com, a couple other channels of weight loss surgery. Some of the people here, Joni Armstrong, Smile and Shrinking, you can check out her story. He did a one and done on her, 13 and a half hours worth of surgery. The woman lost over 230 pounds. She had a lot of wrinkles and crinkles that he took care of, and she looks amazing today. She had her surgery done about, I don't know, 2 years ago, 2.5 years ago, and she has the whole thing documented. Kristen Bonilla had some breast and arm surgery done when I had my arms and breasts done the first trip. She was with me, and she's perfectly happy with her arms, and her breastwork came out beautiful. She just lifted her because she had ample boobs. So I shouldn't be telling her other people's stuff, but I'm sorry about that. But I know they won't mind. These particular women won't mind. And there's a lot of people in our weight loss community here that have used Dr. Soseda for plastic surgery and skin removal. So just check it out on YouTube, and you'll get all kinds of stories, I'm sure. Cost-wise, very affordable compared to what you would pay here for these surgeries. Are just not in my price range. I could not afford it. And truthfully, when you have a great doctor that happens to be geographically located in Mexico, who can do wonderful work for you, give you excellent care, not only at the time, but follow-up care. You know, I mean, anything that I want to ask Dr. Soseda, all I have to do is get on here and email him, and he will respond within less than 24 hours, personally respond. And when you see the man, he's always on his phone, you know, conversing with his patients. It never ends. This is a lifetime relationship if I want it with him. Anyway, great doctor, great prices, great service. I'm trying to remember what I paid. A lot of people don't like to talk about prices, but I think it's important. I think last time I went to him for the breast implants, he had already done the lift before when he took the implants out and didn't replace them. The lift was done. So I had the arms and I had the breast lift and the breast old implants removed and all the damage cleaned up. When he did that, what did it cost? I don't know, maybe, I think the arms were $4,500 and the breast maybe was another $4,000. So I'd say maybe $8,000, give or take. And I remember when he did not put the implants in, he gave me back in American dollars $700. He gave it back to me because he didn't put in the implants. He says, I'm going to give you back the money for the implants. I'm going to, because they didn't use them. I didn't put them in. And next time when you come in, you'll just repay me for the implants when I insert them. So I'd say probably everything, his surgery, probably for everything, the tummy tuck, the extended tummy tuck now. Remember that. Extended tummy tuck, sir. I think that was about $6,400. Over here, it probably would have been $16,000. And the boobs, just to get the boobs done, would have been about between anywhere from, let's say, I've seen as low as 56 to as high as 95, depending upon the quality and the length of time the surgeon's been doing this work. Sometimes they have specials, so like 56 to 100. That was the lowest I ever saw here in America, 5,600. But it wasn't for lift, it was just for first-time implants, just to open you up, put in the implants, close you up, done, 5,600. When you have reversions done or a complication like I had, where they had, take out a messy ruptured implant and clean you up, and Anyway, price it out in America if you're interested in getting some work done, and then price it out in Mexico. Dr. Saucedo is highly recommended. He's done many of our comrades here in the weight loss surgery community, and you can just check out their stories and you'll see how happy and satisfied they are, especially Joni Armstrong in Seattle, Washington, smiling, shrinking. And of course me, I'm a happy girl. So that's my story, and I'm going to shut up because this is a very long video. So that's it from Arizona. By the way, I have on my red wig today. I'm a little redhead. Anyway, okay. Yeah, I do have hair. I'm always wearing a wig on these things, but I have hair. It's just more convenient just to put on a wig and sit down and talk to you. All right, everyone, that's it from Cookie Lou. I hope I gave you some information that was informative and helpful. And love you all. God bless and take care. Bye.